Hey guys, hey, it's Dr. Green here, Lake Norman Health and Wellness. We're going to be talking about beating Lyme disease, a holistic approach. I'm doing this as an online webinar for everybody. Our goal with this workshop is going to be to give you guys copious amounts of information to help you overcome Lyme disease naturally. I want to eliminate this roller coaster of going from doctor to doctor with little or no results for each of you. I want to help really reinvent your life. This workshop is going to provide you with the latest breakthroughs in non-surgical, non-drug therapy and Lyme disease care. Now, I want you to get out a pen and paper. You're going to want to write some stuff down through this workshop. And, I'm here to tell you that there's new hope available to you. Who am I? Dr. Akiba Green. One more time. My name is Dr. Green. Give you guys just a little bit of background on myself. I've got a bunch of letters after my name. What they really mean is that I train, I learn, I keep learning. And first off, I am a chiropractic physician licensed by the state of North Carolina. I've been in private practice since 2004. My clinic is Lake Norman Health and Wellness. But more importantly, what we're looking at is some of my training. I am fellowship trained in integrative cancer therapy through an organization associated with the University of South Florida Medical School. I'm board certified in anti-aging, integrative, and functional medicine through the American Academy of Anti-Aging Medicine. I have specific training, and I'm a certified functional medicine practitioner. I have training in functional neurology, and I'm a certified gluten practitioner. I've had training done by both Dr. Daniel Amen through Brain MD and Dr. Andy Barlow in functional neurology, as well as Dr. Michael Johnson, who is a chiropractic physician in Appleton, Wisconsin, and a top autoimmune specialist. These doctors have all brought to the table different areas of training to me that allow me to be a better doctor for you. And what we're talking about, Lyme disease, right? So we want to support the body in order to allow maximum healing. That's what this is all about. So when we talk about Lyme disease, we're going to jump right in. My goal is going to be to help you find the most effective ways to enhance your immune system. We want to detoxify and we want to decrease inflammation in your body. That way you can reach your maximum potential. One of the top causes of increased inflammation, toxicity, and a lowered immune response in your body is infections. We know Lyme, multiple co-infections, including viruses, bacteria, and parasites, even dental infections can all lead to this inflammation and disease. And what does this mean? Well, your immune system is attacking your body. It's autoimmunity. For Lyme patients, you need to find the antigen or antigens, what we will call triggers, for this autoimmunity. How do you know what to do? Well, how do we know what is the root cause of your problems? It's going to involve the right lab testing and something that we call kinesiology. And I often use the term traditional Chinese medicine to describe a lot of what we do. But the key thing, before we get into lab testing and kinesiology, let's talk about Lyme disease. So Lyme disease is caused by the bacteria Borrelia. Borrelia burgdorferi is the most common species in the United States, and Lyme disease is the fastest growing infectious disease in our country. It's a tick-borne illness. It can carry with it several co-infections. Unfortunately, Lyme disease is very difficult to diagnose due to the fact that it goes through different phases in its life cycle. And because of that, they can be a challenge. So if we look at some of these phases, Borrelia burgdorferi, has the ability to shed its cell wall, to shift into a cyst formation or round body, and move as what's called a spirochete or corkscrew. And what this really means is it has the potential to bury itself in cells and hide from our immune system, making it very difficult for antibiotics to kill, very difficult for our immune system to attack and kill. Lyme has the ability to form a biofilm. A biofilm is formed when the bacteria lands on a membrane. It secretes a mucus-like membrane that allows it to evade the immune system. Once the biofilm reaches a certain size, 4 millimeters, the immune system is unable to penetrate it. That's the reason antibiotic therapy will not get rid of these biofilms. When we look at the incidence of Lyme disease, in 2011, you can see most of the Lyme disease incidence was in the upper northeast part of our country, some in the Midwest, and then you can see sparingly throughout the country cases in various areas. And one dot is placed randomly within the county of residence for each confirmed case. When we talk about that trend, if you go back to the mid-2000s, there's almost no probable cases, but a lot of confirmed cases. And now what we've seen since 2008 is a trend where there are more and more probable cases, which means that maybe this is Lyme. The confirmed cases are all still there. They haven't really gone down much, but a lot more people are getting Lyme symptoms and maybe getting diagnosed, but they're not labeling it. They're not calling it Lyme. And this is important for us because Lyme disease is transferred to humans by ticks, but some research is seeing Lyme in spiders, bed bugs, fleas, mosquitoes, and horseflies. Now, Borrelia is the species of bacteria that causes Lyme disease, and it's found in, Borrelia is also found in tears, semen, vaginal fluid, and saliva. So it's a spirochete bacteria. This can be transferred the same way that syphilis can be transferred. And syphilis is a sexually transmitted disease, which is also a spirochete. Now, Borrelia can be transferred to a child in utero. Pregnant woman who has Lyme can give Borrelia to their child. We look at some of the different sizes. The adult female for the black-leg tick starts tiny little thing. That's a 1/4 inch. You can see how they can be a little bigger. Lone star tick, dog ticks, deer ticks. Again, these are things that you may have seen in the past growing on you, or if you've been out. A lot of people say, oh, I had ticks on me, but they never really had Lyme disease. Well, that's kind of what we're talking about here. Depending on the season of the year, you can have eggs that are hatched in the spring. The larva kind of grows in the summer. By the fall, they become adults. Excuse me. And then the risk of human infection is greatest in the late spring and summer. So when you're out going hiking or doing outdoor activities or gardening, that's when they can get you the most. Lyme disease can carry with it many co-infections. Some common co-infections include ehrlichiosis or anaplasmosis, Bartonella, also known as cat scratch fever, Babesia, which is similar to malaria, FL1953, which is similar to Babesia, Mycoplasma, Brucella, Chlamydia, Salmonella, Leptospirosis, Rickettsia or Rocky Mountain spotted fever, START, which is Southern Tick-Associated Rash illness, and TBRF, which is tick-borne relapsing fever. And there are more than that. I mean, these are just a few of the species. It's interesting. I have a test kit that has a sample Lyme species. It actually has over 70 different species. So when we talk Borrelia, there's actually 20 different types of Borrelias. So it's not just Borrelia burgdorferi, but it can be all these different ones. Now, with that being said, how many of you are tired of struggling with pain, fatigue, numbness, tingling, or other issues day in and day out? Let's look at some of those symptoms. So in acute symptoms of Lyme disease, flu-like symptoms, joint pain, fatigue, headaches, rash, and brain fog are very common. A bullseye rash is pathognomonic for Lyme disease, meaning you don't have to test for it. This rash is known as erythema migraines, and the rash is found anywhere between 20 to 50% of the time, and it can take 3 to 30 days to appear. So when you get bit by a tick, you may not see a rash for many weeks, and because of that, you may miss that it has anything to do with Lyme. So a lot of people never notice the rash that was on their body. Chronic symptoms in Lyme disease can include those acute symptoms, but usually are labeled as something else. So Lyme disease can mimic 300 different diseases: MS, Parkinson's, ALS or Lou Gehrig, Alzheimer's, DJD, degenerative joint disease, fibromyalgia, chronic fatigue syndrome, rheumatoid arthritis, systemic lupus, even thyroid disease or Hashimoto's can all have the same symptoms of Lyme disease. Some questions to ask if you're worried about Lyme disease include, are you having difficulty sleeping? Do you have migratory pain? Do you have chronic fatigue or fibromyalgia? Do you have immune dysfunction, ANA positive or rheumatoid factor positive on a lab test? Do you have neurological disturbances? Do you have ADD, bipolar, obsessive compulsive, depression, or anxiety? Do you have allergies? Do you have endocrine dysfunction? Do you have GI disorders? So what now? What do we do? Well, many of you have one of the previous mentioned diseases, and you've been tested for Lyme disease, and the results may have been negative. So the conventional testing starts with ELISA testing, and ELISA misses 2/3 of the cases. So if the ELISA comes back positive in that 1/3 of the cases, then a Western blot test is done to confirm it. The Western blot has only a 44.6% sensitivity though. This means that Western blot testing is positive in only 44.6% of cases. This leads to a high rate of false negative findings. Due to this inability to accurately detect, Lyme disease is missed in many cases. So we see that the conventional testing misses the majority of the cases. So how do you detect Lyme disease? Well, I'm going to do lab testing. I'm going to start with the Western blot test immediately. We're not going to run the ELISA test. And there are better tests that exist. And we're also going to do something called kinesiology testing. Applied kinesiology, Chinese medicine, and muscle testing play a key role in the ability to properly diagnose the Lyme disease patient. So there are some lab tests that can give us really great pieces of information. A CD57 or HNK1 test is an immune cell that is often elevated in Lyme patients. Complement C3A and C4A also shows a correlation with Lyme disease. 25-OH vitamin D, 125-2-OH vitamin D, both are going to show abnormality in the Lyme disease patient. TNF-alpha, tumor necrosis factor alpha, IL-1 and 6, interleukin 1 and 6. These are immune cytokines or chemical messengers. They're immune cells, and they often show with what's called sickness syndrome. The IgeneX lab is a lab that does a very sensitive Western blot test that's more detailed. We'll run that many times. There's a test that I use called CNS vital signs that helps us establish brain involvement and neurological dysfunction. And even visual contrast testing for Lyme neurological symptoms is something that we'll use to help confirm if a patient has Lyme disease. Now, there's some trends that we see in Lyme patients with metabolic panels. High or low white blood cells, high lymphs, low neutrophils, and vice versa. High monocytes and eosinophils. These are white blood cells, but specific types. Insulin resistance, so high fasting glucose or the hemoglobin A1C. How about high C-reactive protein, fibrinogen or SED rate? Thyroid antibodies, present or elevated. Imbalanced sodium, potassium, chloride, or magnesium levels. Low CD57, and high complement cells, C3A, C4A. Excuse me. We'll often also see the presence of the MTHFR gene mutation. Low vitamin D, 25-OH, high 125-2-OH, so the abnormal types of vitamin D will show up. Low CO2, and a couple of markers like antiphospholipid antibodies, anticardiolipin antibodies. These are certain autoimmune reactions. Elevated liver enzymes, AST, ALT, GGT. Elevated uric acid, BUN, or creatinine. Positive ANA antibodies, positive rheumatoid factors, or other autoimmune markers, and high coagulation markers, including fibrinogen. So I know that's a mouthful. I'll give you guys a quick second. If we need to go back, you can watch this video and you can get these tests down. But these are a lot of the tests that we will run on patients to see if they have Lyme disease, especially if a Western blot or traditional marker does not show positive. Now, Borrelia specifically has the ability to express lipoproteins on the outer membrane of their cell wall. These lipoproteins are pro-inflammatory. This means that they cause inflammation. They attract white blood cells, some of those are called neutrophils, and they induce immune chemicals called cytokines, as well as lymphocytes, these are another form of white blood cell, to transform our B cells, or immune soldiers. Basically, they do this 50 to 500 more times than other lipoproteins and other bacteria, meaning they react to our immune system at a significantly higher rate than other diseases. Another key with Lyme is something called molecular mimicry, and this can occur in the peripheral nervous system when Borrelia-specific antibodies, called IgM antibodies, go after the tail or flagellum of the bacteria. It's called cross-reaction, and this occurs with nerve tissue like myelin sheathing. This is what we have that wraps around our nerves and allows the neurons to fire. And this can give the presentation of multiple sclerosis-like symptoms or neuropathy in the Lyme patient. These agents create an inflammatory cascade. TNF-alpha, interleukin 6, interleukin 1, we talked about earlier. These are immune cells, immune chemicals, messengers. They'll produce free radicals. They'll create oxidative stress that damages cell membranes, the mitochondria in our cells, that's our power plant, as well as nerve cells. This is vital. In fact, some agents produce neurotoxins called quinolinic acid, as well as other toxins that damage the nerve cells further. The end result is going to be autoimmunity. Now, autoimmunity may result from antibodies against these agents, and they cross-react with our own tissue. The immune system says, Lyme, I'm going to attack you, but it also says, immune system, I'm going to attack you as well. ANA, I'm going to attack you. Rheumatoid, I'm going to attack you. Thyroid, I'm going to attack you. Your tissues, I'm going to attack you, because it may not know the difference. It's called cross-reactivity or molecular mimicry. Now, Lyme has the ability to shed particles of DNA, partial DNA. They're called blebs or plasmids. And these blebs will cause the immune system to react, and the blebs will convert host cells into immune targets. So Lyme has the ability to basically turn on more targets, more markers that the immune system goes after and attacks. Again, we end up with the autoimmune disease. That's the result. And this is why you can get the positive ANA, rheumatoid factor, or other autoimmune factors. It's even more severity is seen in patients who have certain rheumatoid markers, HLA-DR2 and 4 as well. The second component to identifying Lyme is kinesiology testing. We use a double bilateral O-ring test, like this picture you have right here. What it allows us to do through a technique called field control therapy and a technique called quantum reflex analysis, or QRA, and a technique called field Newell protocol, developed by Dr. Field, is assess for organ dysfunction and infections much more detailed than what we find in lab testing alone. Truly combining the best of traditional medicine with alternative or Eastern medicine. Now, when we talk Lyme co-infections, let's discuss the predominant co-infections associated with Lyme disease. So Bartonella, there's certain symptoms. People tend to be cold hands and feet, sharp pains on the soles of the feet, sharp shooting knife-like headaches, hot flashes, joint pain, swollen lymph nodes, gastritis, high liver enzymes, an enlarged spleen, and trouble sleeping. Bartonella can develop into other diseases, bacillary angiomatosis, pileosis, hepatitis are the names of two diseases. Carrion's disease, which includes roya fever and verruga peruana, cat scratch fever, chronic fatigue syndrome, endocarditis, which is inflammation of the heart valves, erythema multiforme, pink-red skin blotches, erythema nodosum, inflammation of fat cells under the skin, recurrent bacteremia, bacteria in the blood, uveitis, which is eye inflammation, and thrombocytopenic purpura, which is low blood platelets. How about babesia? Some symptoms in babesia: fatigue, night sweats, joint pain, fever, chills, weakness, weight loss, nausea, iron deficiency anemia, abdominal pain, shortness of breath and cough, headaches, neck and back pain, dark bloody urine. Ehrlichiosis, fever, chills, myalgia, headache, confusion, neurological consequences, red eyes, nausea, and vomiting. Mycoplasma is another disease that is considered a Lyme co-infection. Symptoms include Gulf War syndrome, atypical or walking pneumonia, chronic fatigue, hair loss, insomnia, GI problems, joint pain, anxiety, headaches, cognitive problems, neurological problems, and this mimics many autoimmune diseases, everything from ALS, rheumatoid arthritis, irritable bowel disease like Crohn's, MS, chronic fatigue syndrome, or myalgic encephalopathy can all, or ME, can all mimic mycoplasma. How about chlamydia pneumoniae, chronic cough, atypical pneumonia, walking pneumonia, headache, malaise, bronchitis, laryngitis, rhinitis, sinusitis, asthma, ear infection, endocarditis, erythema nodosa, which is a skin disorder, Guillain-Barré syndrome, and encephalitis. So how about acute versus chronic Lyme? Let's discuss the differences between acute Lyme and chronic Lyme disease. Acute Lyme has more flu-like symptoms. It responds well to antibiotic treatment. Chronic Lyme disease does not respond well to antibiotic treatment and is usually seen as other diseases. Chronic Lyme can be a lifelong issue. Patients with chronic Lyme can have the following: pain that comes and goes and migrates, arthritis, myalgia, neuropathic pain. Pain is influenced by hormonal cycles. So it's worse with Herxheimer's reactions before, during, or after your hormones. Antibiotic use may increase or decrease pain. Again, a Herxheimer's reaction in people treated for urinary tract infections or sinusitis. Pain might be resistant to standard treatment protocols. So you have pain and NSAIDs, SSRIs, narcotics, or neuroleptic medications don't help the pain. Pain is associated with multisystemic symptoms, complaints in multiple systems in your body along with the pain. Those are all classic chronic Lyme patients. A large percentage of the patients that we see who have chronic Lyme present with multiple diseases, multiple systems, and multiple body parts, and that's why it can be so difficult to treat that patient properly. There's a genetic marker that we want to be familiar with. It's called MTHFR. This is methylene tetrahydrofolate reductase. And many chronic Lyme patients have the MTHFR gene. It's an abnormality in the ability for your body to methylate or take methyl donors, certain nutrients that our body requires, and help convert them for use by the body. Methylation is the process of taking these methyl groups to the cell at the level of the DNA. And defects within this gene causes an elevation in an inflammatory marker called homocysteine. This will make the person more likely to turn on bad genes. Your stomach is the primary methyl donor, so a huge correlation between MTHFR and gastrointestinal health. In fact, the methylation process is dependent on B vitamins like B6, folic acid, B12, S-adenosylmethionine, and trimethylglycine, or TMG. In fact, MTHFR is the actual enzyme that processes folic acid itself, but they all play a key role. Now, glutathione is another key concept that we need, and many Lyme patients are in need of detoxing in their body. Glutathione is an excellent way to help open with detoxification and reduce inflammation. Now, we can use coffee enemas as a great way to increase your glutathione levels, along with supplementation through NAC or N-acetylcysteine, liposomal glutathione, or S-acetylglutathione. We utilize liposomal glutathione. I prefer certain brands that seem to work really well with our patients, and it is a much more available use of glutathione in the system. It gets through the liver, through the digestive tract, and your body's really able to benefit from it. All right, let's talk treatment, okay? Medical approaches, alternative approaches, my approach, specific testing, how I can help you, and some things that you can do to help yourself. All right, the medical approach. I hate to say it, this is a weakness, especially in North Carolina, but I know in the large parts of the country. A lot of medical doctors blow off Lyme patients. I don't mean this derogatory toward medical doctors at all. I have a tremendous respect for what they do. I have a lot of referrals with the medical market, but we know that a lot of medical doctors don't believe that chronic Lyme disease is in our region. I have had infectious disease doctors that will not diagnose a Lyme patient, despite symptoms, despite having a erythema migraine or the rash, bullseye rash. They'll tell patients it's not Lyme, your symptoms are in your head, it's depression, learn to live with it, exercise, lose weight. I mean, we hear all sorts of things, and it's not just medical doctors, it's especially infectious disease doctors. There's a huge, huge weakness in education. There's a huge weakness in training in our state, if not throughout the country, on the Lyme disease patient. There are a lot of really sharp doctors that are out there, medical doctors, PhDs, who teach us about diagnosing Lyme, but the average doctor a lot of times just doesn't know enough, and the patients get stuck being told that it's in their head or they don't have a real disease. My approach is what we call an integrated or functional medicine approach. And what's the best approach for the individual patient? That's the point. It's not one system. So how do I know how I'm going to get you better? I'm going to use lab tests to help figure out the root causes of your Lyme disease. And we're going to use traditional Chinese medicine, applied kinesiology, and muscle testing to help identify those causes. Lyme disease is a chronic illness. Your body has been sick for years, and you have most likely been mismanaged. So along with Lyme disease, you do have other health breakers that we have to talk about. So whether it's the Lyme disease patient, the hypothyroid or autoimmune patient, the integrative cancer patient that we see in our clinic, I can't just treat your Lyme if I don't fix your body, if I don't treat your body. In these other systems, it's what I call a web of physiological dysfunction. So you're going to have issues with Lyme. It's an immune system imbalance. You're going to have liver problems, hormone imbalances, thyroid dysfunction, gut dysfunction, adrenal function, blood sugar imbalances. How about emotional stress, cellular dysfunction, all these systems going on in your body at once. If we don't address all these problems, then you're not going to get better. So the web of physiological dysfunction looks very confusing. There's a lot going on, and it can be. And many doctors give up and pass the buck to the next specialist. If we don't address specific problems in your web, you're never going to fix your chronic Lyme disease. So what would trigger your immune system to do this? Well, the gut problems, gut dysfunction, 80% of your immune system is in the gut. Blood sugar dysregulation, inflammation, autoimmune reactions, brain neurotransmitter dysfunction, anemia, lymphatic or lymph problems, liver gallbladder dysfunction, fatty acid metabolism problems, carbohydrate metabolism dysregulation, energy production problems, EMFs are electromagnetic field radiation. So think cell phones, microwaves, Wi-Fi's, towers. EMFs can impact our health. Dental work, dental infections, dental or gum infections, dental fillings. How about toxicity issues, chemical toxicity, food sensitivities, the presence of leaky gut syndrome or intestinal permeability, methylation issues or genetic predispositions can all contribute to your immune system attacking you. And the key thing is proper testing is required to fix it. If we don't do proper testing, if we don't find out your combination, then you're not going to get better. And all these systems, all these organs need to be functioning optimally for you to have maximum healing. So lab testing, let's talk about lab testing for a second. Lab ranges are very broad. And when we look at the labs that you need, you got to make sure you're running the right tests. So blood work, we're going to run a comprehensive metabolic panel, checking glucose, the hemoglobin A1C or diabetes markers, liver, kidneys, iron levels, 2 vitamin D tests, C-reactive protein, homocysteine, fibrinogen, these are inflammatory markers, uric acid, the list goes on and on. We're going to do a CBC with differential to know what your white blood cells are doing. I'm going to look at your thyroid panel. The thyroid panel I'm running consists of 9 tests, not one, not just TSH. We're going to look at free T4, free T3, thyroid antibodies, T3 uptake, reverse T3, free thyroxine index, all these markers. How about your lipid panel? Cholesterol, good and bad cholesterol, triglycerides. Sensitivity or reactivity testing. We're going to run food sensitivity tests. We're going to look for leaky gut or intestinal permeability. There's a marker called actin. It's degradation of the intestinal lining. A marker called lipopolysaccharides. This is dysbiosis or bad bacteria that's taken over from the good gut bacteria. Zonulin, the tight junctions in your small intestine are failing, allowing toxins in the gut to get out into contact with your body. How about gluten? Gluten reactivity is much more than the celiac test. There's markers like glutenin, gliadin, gluteomorphin, wheat germ agglutinin. There's actually a ton of markers that we look at associated with gluten beyond just celiac. And we deal with food sensitivity and cross-reactivity tests for corn, rice, potato, other grains, coffee, dairy, soy, the list goes on. We're talking about food sensitivities, allergens to the body. We run a test called Vibrant America that tests your immune system against food antigens and sees reactivity or severity of these food antigens for 92 different foods. Chemicals, dyes, additives, herbs, and medications can also be tested. How about an organic acid test? This looks at fatty acid metabolism, carbohydrate metabolism, B-complex markers, methylation markers, neurotransmitter markers, detox markers. We're going to look at a stool test for some patients. The vast majority of Lyme patients are autoimmune. We need to find out what is causing it. It could be parasites, mold, yeast, fungus, bacteria, or viruses. It could be one or more of them, but we have to test to find out. How about hormone testing? So adrenal and hormone testing. I use a lab called Precision Analytical. They have a test called the Dutch test. It's actually a urine test that you complete at home. And it checks your adrenal glands. They sit on top of your kidneys. They're your stress glands. You've got a chronic condition. Your body's been under this physical stress. This is a very important test. But I'll also tell you, it's not just about the adrenals. It's about your hormones. So testing male and female markers. Estrogen, there's 8 different estrogen metabolites I look at. 2 different progesterones, testosterone, 3 testosterones, androstenedione, DHEA, melatonin, all these markers we're going to look at and get an absolute understanding of what's going on with your hormones. Heavy metal testing. So heavy metals are assessed, and heavy metals greatly interfere with the parathyroid and thyroid gland. This includes mercury, and this can impact your health. Now, lab ranges. So when you go to lab, and I use Quest and LabCorp to do most of my lab work. These are big labs, right? Everybody has them. Everybody's been to them or you've heard of them. They have a lab range, a reference range. I get that range back, and it shows me this broad range. That broad range is just statistics. It's a bell curve. That bell curve is not going to give me what I need to do. So we're going to look at functional ranges, narrower ranges. TSH, the lab range is 0.45 to 4.5. Well, how about we want a functional range of 1 to 2.5? How about TPO or TGB, thyroid antibodies? I don't want to see any result, but it's a big, broad range. If we see anything, we know there's antibodies. Glucose, 75 to 85. That's our normal range that we're going to look for. Not 100, not 99, that's pre-diabetic. Stored iron, very narrow range that we want, not this big, broad range. Liver enzymes, I want less than 26, 10 to 26. If you're elevated, that tells us you have a liver problem. All right, patients with any type of chronic disease, including Lyme disease, should not consume foods that contain fructose or refined sugar. AGEs, or advanced glycation end products, signal glial cells to produce superoxide and nitric oxide. The combination can then produce the powerful free radical peroxynitrite that can worsen any chronic disease by damaging your DNA, your cellular DNA, your mitochondrial DNA. I use individually tailored natural protocols to allow your body to achieve maximum healing. It has to be individually tailored because no two Lyme patients are alike. This is how we're going to help you heal. Our goal is to decrease inflammation, detoxify your body, and increase the function of your immune system. I want to give you hope. I want to give you empowerment to get the answers that you're looking for. I want to give you control of your own health. The medical system, the doctors you've seen have taken that away from you and told you there's nothing you can do. That is wrong. I want to give you the options that allow you to help you not just survive, but thrive in your health. Get the quality of life that you want. Now we know life is always a matter of choices. If you like what you heard, if you appreciate the information that we've shared with you, I can sit up here all day, I can preach and teach you more about how I help the Lyme patient, but it really comes down to one simple life decision. In order for me to help you to reinvent your life, you're going to have to set an appointment. Now, our normal new patient appointment is $179. It covers 2 visits in my office. Those are either 2 one-hour sessions in my office or 2 one-hour sessions, up to 2 one-hour sessions through our distance virtual program as well. Because you guys joined me on this workshop, I have a discounted fee of $69 that you can use, and this will not expire. If you watch this workshop, you will get access to this discounted fee. This is for both in-office and virtual distance care patients. All you have to do is call my office, and we'll get you scheduled. Now, I thank you very much for watching. Our office number is 704-987-3993. My website has a ton of information on it. It's www.drakibagreen.com. That's DRAKIBAGREEN.com. When you get on there, you can click schedule today or new patient in order to make an appointment with me. I thank you for watching us. I look forward to meeting with each of you. You know, it is important for me to share a little bit of additional information with you as well. And you know, thank you again. Happy healing. If you want to stick around, I've got a few more things for you. It is important to understand that the type of care that we do often does not allow insurance to cover it. In the functional medicine model, insurance would rather you get surgery or take a pill, and that's kind of it. We do see coverage for labs a lot of times. Some of the labs that I use are really good quality labs that are out of network. So that's a whole discussion that we can have. But you know, you have to see that your health has value to you. You have to see that this approach makes sense to you. We're here to get people better that oftentimes don't have anywhere else to go. People come to us many times as a last hope. I have seen patients who've been to 5, 10, 20 other providers trying to get the answers they're looking for. When you're ready for this type of commitment, we're here for you. We'll do everything in our power to work within your finances. It's important for you to understand that. Information without action is not going to help you. So you have to set an appointment for a consultation if you want us to help you. I look forward to that opportunity to help give you the best chance for living a full, long, happy life full of energy. Now, there are some things that you can do now. I want to give you guys some information to take with you that'll allow you to get where you want to be. Number one, change your diet. No refined sugar, no high fructose corn syrup, no soda, reduce your red meat content, no caffeine, no alcohol, no white flour, no white salt, no fruit juices, no highly saturated fats, trans fats, all food additives, coloring agents, preservatives, no junk food. If you smoke, stop now. Increase the amount of fresh organic vegetables in your diet. No or very limited fruits. The sugar content in fruits, even though it's natural sugars, is high. You can have stone fruits once a week. There's going to be, think berries, but also pitted fruits. Organic, grass-fed meat. Chicken and fish mostly. Limited, if any, red meats. I do have a belief on wild game with much healthier nutritional values than traditional red meat. And we can talk about that if it's something that fits you individually. The key thing is you got to detox. Detoxification using massage, sauna, steam rooms. Drink distilled water or reverse osmosis water, but just pure water with nothing in it. Vitamin D, get out in the sun. Take supplements, but make sure you're taking the right supplements for you. We can help you with that. Other providers can help you with that as well. Use good fats, coconut oil, olive oil, nuts, and avocados. Stop eating gluten, dairy, and soy. Exercise. Read labels. If it says natural flavoring, that means it's got MSG. Some final thoughts for you. Where there is no vision, the people perish. Picture yourself getting better and doing the things that you love to do. Travel, participating in sports, going back to school. See yourself spending more time with your family and friends. Your body will heal, but it needs the right tools and equipment. Remember, you are the treasure. Not your house, not your boat, not your investments. You. Your health is the best investment you will ever make. Please share this workshop with others. On Facebook, like our page if you haven't. Share this workshop, share our page. Internet message boards, Instagram, Twitter, Snapchat if you want to, wherever it is. Tell your family, friends, let them know that there are options that are out there. Help me spread the word that there's another approach, that there's a better approach to getting the health that you're looking for. Once again, if you're interested in setting up an evaluation, call my office at 704-987-3993. If you would like to email me with any questions, my email is akiba@drakibagreen.com. That's AKIBA at DRAKIBAGREEN.com. I'll leave you with this. Don't judge each day by the harvest you reap, by the seeds you plant. Robert Louis Stevenson. Thank you very much for joining us. Take care.